bolster the healthcare workforce in the coming years?
Yeah, a couple things that we see is one, we're encouraging hospitals and all healthcare providers, and we're seeing some evidence of this, to use technology to your advantage, right? So if you've got, let's say, a guy who needs to see a doctor, but he can see that doctor from the comfort of his own home, doing a telehealth appointment. Sometimes you got to go into the doctor. Sometimes you can actually do that by just talking to the doctor at home. That we're trying to encourage because that puts less stress on some of the healthcare workers. If you can just see somebody quickly, it's in and out, you don't have to deal with all the paperwork of coming in for a doctor's visit. That's one of the ways that you relieve that stress and shortage that we see in our healthcare workforce. The other thing is that we're investing a lot to try to make sure that we meet the doctor, the nurse, the physician assistant shortage. The basic problem that we had in our country is that for a long time, we would encourage people to get like women's studies degrees in the United States of America, which, maybe you need a few of those. I'm not sure how much, but what you really need is doctors. You need nurses. You need people who can work with their hands. You need people who can work on a farm. You need people who build and make things and take care of people. And our education system just really underinvested in training the next generation of healthcare workers. That's not a problem that's going to be solved overnight, but it is something we're working to solve because I see kids in the audience. I'm sure everybody has a young person who wants to be a healthcare worker, knows somebody in your family or your friendship circle that wants to work in healthcare. We got to make it easier for our young people to choose those careers. Unfortunately, for a very long time, we've actually made it harder for people to go into the healthcare field. We layer up those who do with debt, and we make it harder for them to join the workforce. We're trying to make it easier for people to enter the healthcare field, and in doing that, that's how you release the long-term shortage. So, that's all I have. I appreciate everybody who asked a question. I'm sorry if you didn't get time to ask a question, but let me just leave you with this one final thought. So I've got 3 little kids at home, and I've got one on the way. I've got an 8-year-old, I've got a 6-year-old, I've got a 4-year-old, and Usha is pregnant with baby number 4, which we're very happy about, very proud of. Thank you. But my 8-year-old, he's gotten really into football in the last probably 3 or 4 months. Don't hold it against him. He's an Ohio State fan. That's his dad rubbing off on him. Are we Wisconsin fans here in central Wisconsin? Okay. But here's the thing. We watched over the past few days. We watched Rudy. Does everybody remember the movie Rudy? About this guy. He was too little. He wasn't fast enough. He was 5'6", but he worked his tail end off and he made the Notre Dame